going to be discussing the 3 most common complications in childbirth, how they're managed, and whether or not they're preventable. If you're new here, my name is Jamie. I've been a midwife for over a decade. Postpartum hemorrhage is one of the scariest complications, and although it is one of the most common ones, it still only happens in less than 5% of births. While it can be serious, there are clear causes and ways it can be prevented and managed. So what is a postpartum hemorrhage? In pregnancy, your blood volume expands by 40 to 50%. So pregnant women have the capacity to lose more blood than a non-pregnant person. The amount of blood that is often lost in childbirth typically doesn't exceed 500 cc's, which is a little bit more than 2 cups of blood. Postpartum hemorrhage would be blood loss exceeding that amount. So let's break it down. The first and most common cause of postpartum hemorrhage is lack of tone in the uterus. Where the bleeding comes from in this case is the site where the placenta was previously attached is now an open wound. After the birth of the child and the placenta, the uterus contracts down and closes off those vessels to prevent excessive bleeding. Now, reasons that would not happen is the uterus is exhausted. It's a muscle and it's worked hard. We have extremely long births that can cause this, and even honestly really quick births can cause this problem because the uterus is exhausted from working really quickly and just hasn't clamped down. The first thing that's typically done is your provider will massage your uterus to cause it to contract and cause that bleeding to stop. Sometimes they have to massage it, and that removes some clots that build up that prevent it from squeezing down. Not fun, but better than the alternative. The second cause of postpartum hemorrhage is retained tissue. So when the placenta detaches from the uterine wall, maybe some of the placenta or even the membranes got left behind. What we can do to prevent that is have a provider who is not going to be aggressive with delivery of the placenta. If they are too aggressive and trying to deliver the placenta immediately after birth, parts of it can tear off. So you can talk to your provider ahead of time about a more gentle third stage or delivering the placenta. If some tissue is retained, this can be diagnosed through ultrasound or by your provider inspecting the placenta after birth and realizing that not all the parts are there, and they may manually go up with a gloved hand and remove the tissues, clots, membranes, whatever's left in there. Or if it is more serious, they may put a person under and perform a D&C to clear it out and cauterize the area to prevent further bleeding. Tearing is another cause of postpartum hemorrhage, but it's not one of the most common causes. Bringing the tear together will typically stop the bleeding from progressing. The fourth reason that women would bleed excessively after birth is a clotting disorder. Now, most women are receiving blood work, at least in first world countries, to rule out issues like blood clotting disorders. Rarely, they can be developed later on in pregnancy, but there are often other signs and symptoms that are presenting alongside with that. So those are the 4 main reasons that women bleed excessively after giving birth. Now, how are they prevented? First and foremost, find a provider who you trust to manage this complication. You can ask them while interviewing. You can ask at any point during your pregnancy how they manage postpartum bleeding. Typically, hospitals at this point actively manage it by giving women Pitocin. If you're not already receiving it from an induction or an augmented birth, they will give it to you after birth, either in an IV, or if you had a quick birth, they don't have time to give you an IV, it would be a shot, typically in the thigh. Massaging the uterus is preventative because it is causing the uterus to stay contracted so that it's not bleeding excessively. If it's a tear, obviously the first step of action would be repairing it, and that usually solves that problem. Now, what can you do prenatally to prevent postpartum hemorrhage? One of the things that I always encourage people to do prenatally is focus on foods or supplements that are building up your blood supply towards the end of pregnancy. These are foods rich in iron. Vitamin K is really important for blood clotting. Even foods rich in magnesium are going to help your uterus, because it's a muscle, contract effectively after birth. And foods that are rich in protein. So vitamin K and protein is what the body uses to form clots and prevent bleeding. So again, because your uterus is a muscle, it is important to hydrate it in labor, either through fluids orally or of course during an IV, and eating throughout labor to make sure it can function how it is intended to after the baby is born. So the takeaway, prevent postpartum hemorrhage by nourishing yourself at the end of pregnancy and in early labor, and get a provider that you trust to manage postpartum hemorrhage effectively after the birth. Next up, we'll be discussing shoulder dystocias and neonatal resuscitation.